Thanks. Thank you, Chairwoman Capito, and thank you, Ranking Member Senator Baldwin, and all the members of this committee. I'm honored to appear before you today to present the Department of Health and Human Services fiscal year 2026 budget. Debilitating disease, contaminated food, toxic environments, addiction, mental health affect families across every race, class, and political belief. And my team and I took the helm at HHS. We set out with clear goals. First, we aimed to make America healthy again with a special focus on chronic disease epidemic. Second, we committed to delivering more efficient, responsive, and effective service to the over 100 million Americans who rely on Medicare, Medicaid, and other programs. Third, we focused on achieving these goals while cutting costs for taxpayers. We intend to do more, a lot more, with less. The budget I'm presenting today supports these goals and reflects two enduring American values: compassion and responsibility. I invite the committee to unite around these ideals with me. The United States remains the sickest developing nation, despite the fact that we spend $4.5 trillion annually on health care, 2 to 3 times more per capita than comparable nations. Clearly, something is structurally wrong. All the money that we've been pouring into these programs for years has not resulted in better health for Americans. Furthermore, healthcare costs are steadily increasing at a rate of 2% greater than the economy. If we don't staunch this unsustainable hemorrhage, we will ransom our children to bankruptcy, servitude, and disastrous health consequences. Yes, an exploding debt is a social determinant of health. We won't solve this problem by throwing more money at it. We must spend smarter. We will shift funding away from bureaucracy toward direct impact. Some things at HHS will not change. We will preserve legacy programs like Medicare, Medicaid, and Head Start as the foundation of the MAHA agenda. Vulnerable populations, seniors, veterans, American Indians deserve consistent access to care, and I will ensure that they receive it. Today, 83 million Americans, urban and rural, lack adequate access to primary health care physicians. We will prioritize these families, especially the Native American and Alaskan communities. Protect IHS funding, streamline its operations, and give the tribes more autonomy in managing their resources. Let me be clear, we intend to make the Trump HHS not just the most effective, but also the most compassionate in U.S. history. Our official budget statement outlines many priorities, but I want to highlight a few. First, we will consolidate programs to better tackle mental health and addiction. These issues now rival chronic disease and their impact. HHS will aggressively combat the opioid crisis, especially the spread of synthetic drugs like fentanyl. We will empower state, local, and tribal leaders to create effective solutions. Second, we will address nutrition, physical activity, and healthy lifestyles. The President's budget requests $94 billion in discretionary funds to support these priorities, including the Administration for Healthy America. We will emphasize healthy eating and Head Start and ensure the program continues to serve its 750,000 children and parents effectively. Third, we will equip the FDA to expand its food safety efforts through research, regulation, inspection, and education to remove harmful chemicals from food and packaging. Fourth, we will fund cutting-edge research at the NIH while cutting risky or non-essential studies. That includes ending gain-of-function experiments and research based upon radical gender ideology. At the CDC, we will return to core missions, tracking diseases, investigating outbreaks, and sustaining public health infrastructure while cutting waste. Fifth, we will eliminate DEI funding and redirect resources toward real poverty reduction. We will move beyond lip service to communities of color and take meaningful action to meet their needs, as we did last week when we approved South Carolina's application for support for a program, the first program in the country that provides cell therapy and gene therapy to every person in South Carolina who has sickle cell anemia. For a fifth, we will eliminate DEI funding and redirect. Six, we will strengthen cybersecurity and health IT. The AI revolution has arrived, and we will be the cutting-edge agency using this technology to manage healthcare data more efficiently and securely, and to give Americans control over their own health. Finally, we will rebuild public trust that eroded through years of industry capture, waste, and misplaced priorities. We will launch a new era of transparency in public service, creating an honest, science-driven HHS that answers to the President, to Congress, and the American people. And I just want to say, salute the people wearing purple in this room. I assume as an emblem of their commitment to solving the Alzheimer's crisis. And Alzheimer's is a very, very good example of how NIH has gone off the rail over the past 20 years with research on amyloid plaques and cutting off any other hypothesis because of corruption within the agency. And that has derailed Alzheimer's research in this country for 20 years. And I'm committed to solving the problems of Alzheimer's, also understanding why we're having an epidemic of Alzheimer's, why it is increasing. And I have Alzheimer's in my family, and many members of my family are activists in this community, and I have a deep personal commitment to solving this issue. I look forward to working with Congress to pursue this mission together as a bipartisan cause. Let's work side by side to make America healthy again.